Hello, my name is Danielle, and I chose a new theoretical model for the development of pressure ulcers and other dependent related lesions for my middle range theory project. Some background info about me is that I am a nurse on a progressive pulmonary care unit, also known as an ICU step-down unit. We mainly get patients who have COPD, or have emergency lung surgeries, or also that who come from ICU, who have come off of ventilators. So, pressure ulcers are skin or soft tissue injuries that form due to prolonged exposure exerted over specific areas of the body. And some of the pathophysiology behind that is external pressure on soft tissue exceeds arterial capillary pressure and impairs venous blood return. So these are just some pictures of some pressure ulcer stages. And these are pictures of pressure ulcer stages with real life examples. So here you can see that this is a non-blanchable red heel. Here you can see we've broken through the dermis and epidermis. Stage 3, we've gotten to the fatty layer of the tissue. And then stage 4, we've gotten right down to the bone. And there also is unstageable. And you can also sometimes develop a scar as well. So who's at risk for pressure ulcers? These are common in patients who can be bedbound, suffer from malnutrition, hypotension, dehydration, or have received prolonged anesthesia and surgery. So this theory explained is the purpose of this theory, I should say, is to review the risk factors in pressure ulcer, risk assessment scales, and construct a theoretical model for identifying the underlying cause of pressure ulcers. So overall, this theory's point is to look at the underlying cause of pressure ulcers and how we as clinicians can identify the risk factors early. The method used was also known as the Delphi method and was the researchers conducted a search of main databases between 1962 and 2009, and risk factors were identified and grouped into different risk dimensions to construct a new theoretical model. The result is that the 23 risk dimensions were used to construct a middle range theory for chronic wound development. So the 4 meta paradigms: person, environment, health, and nursing, and I've shown how they relate to my theory. Lesions can appear in patients who are unable to care for themselves regardless of their age, process, or disease status, and pressure ulcers are products of intense environments that include increased shear and friction and are dependent on pressure and moisture. So for health, the most common problem is infection. So with an open wound and being in a hospital environment, these patients are at an increased risk for infection, and that can get into the bloodstream, which could cause more health issues for a patient. And nurses and other professionals could use this model as a guide for diagnosis and classification of dependence-related lesions and for risk assessment. So in my practice setting, since I work in an ICU step-down unit, these patients are already at risk for pressure injuries since they have been unable to get out of bed and can develop incontinence, causing them to be in moist environments, which contribute to pressure injuries. This theory can also be applied to my practice setting by recognizing the risk factors and preventing them using the risk assessment scales, and also frequently turning and cleaning patients. My first example is that if a patient was admitted to my unit, I will assess the risk for pressure ulcers using the theoretical method risk assessment and implement the proper pressure injury prevention methods. My second example is that if a patient on my unit develops a pressure injury, I will treat it according to hospital policy and protocol, and I will assess what made the patient at risk according to the theoretical model and use this to prevent future pressure injuries. Thank you for watching.